Good afternoon, and welcome to My World Science, where we discuss everything scientific in our lives. Knowledge is power, and we hope to inspire you to use scientific knowledge to make your life and the world around you a better place. Today, we're going to unravel some of the mysteries of medical imaging studies and how medical imaging can help you and your doctor on your road to wellness. I'm Noah Kittle, and welcome to My World Science. Today, we welcome to our show Dr. Elliot Azizollahi, a radiologist with Kaiser who specializes in breast imaging. Today, we welcome to our show Dr. Elliot Azizollahi, a radiologist with Kaiser who specializes in breast imaging studies. Dr. Azizollahi graduated from the University of Southern California Medical School in 2005, then went on to UCLA Harbor for his residency, internship, and fellowship. A volunteer with the Beverly Hills Science Fair and a beloved resident of Beverly Hills since 2013, we welcome Dr. Azizollahi to our show.
Thank you. Thanks for having me.
Yeah, no problem. So I'm really excited, and I would like to start with your journey into medical science. Was your family perhaps part of medicine?
Well, my journey, I don't know if it's the typical one or not, but I did have some family members in medicine. My mom, she was a dentist, and her sisters were doctors. Actually, all three of them went to medical school.
Wow.
And for a while, I thought he was either going to be a dentist or a doctor, but I didn't know why. But I think what really pushed me over the edge was probably my pediatrician. Like, I always enjoyed going to him.
Yeah.
It was always fun to see him. And once I got older, like, I saw that side of him, which meant that he would take care of people and he was saving people's lives, and that was always important to me.
Did you perhaps think that you would become a pediatrician?
Yeah, actually, whatever rotation I was on in medical school, I was like, that's what I want to do, because I enjoyed everything. Except OBGYN, I think I hated that. But I didn't like staying up late at night all the time. But but almost everything I enjoyed.
Yeah, that's good. So I Googled some radiology studies before you arrived, and I have to admit, it's pretty hard to tell what we're looking at. Here we go. Yeah.
So let me help you here.
Yeah.
This is one of the most common studies I look at. This is a mammogram, and we're looking for cancer in these pictures.
Okay.
And so this is I'll tell you, this is the normal side, and this other side is this side over here is the abnormal side.
Yeah, I see that.
Yeah. So I don't know if you could tell, but this thing right here, this is not on the other side. And we we actually look for differences all the time for what's normal and what's not. And this definitely stands out. And what I see right here is a mass growing that's not normal. It has an irregular appearance. You could have some benign things, and that's that's something that we would normally worry about. And on the next image, this is a more side. The other one was a top-down view. This is the view from the side, and in this, on the left side again, we see a mass, and it's irregular.
Yeah. So I guess this body being symmetrical really helps out, I guess, with cancer.
Oh, with everything, yeah.
Yeah, cancer only really appears in one side of the body at a time, and that's kind of how you're. Because in theory, if they were to have cancer in both places,
that would make it more difficult.
Right.
Because we look for things that are asymmetric. That's actually, when we write our reports, we say there is an asymmetry on this side, because when we compare from one side to another. If they were to both look the same, it would throw us off.
And that's also how you look for melanoma too, is if any moles are asymmetrical, if they're not circular, and if they're changing in shape over time.
Yeah. A lot of things in medicine translate from one thing to another, like in how breast cancer looks is often how lung cancer could look, and how melanoma might look. It's things that are more irregular are more worrisome typically. Yeah.
These strands, are they veins or are they the glands?
So that's actually a really good question. Both. Some of this white stuff and these strandy things are either the arteries. The things that are tubular or linear like that are going to be the arteries or veins. The milk ducts could look like that too. And also the architecture that holds everything together also has a linear appearance to it.
Okay.
Yeah.
And I'm curious, what's that?
So these there's different things here. Most of this stuff is normal.
Oh, okay.
This triangular shaped thing, this is the muscle, the pectoralis muscle that you're getting here.
Okay, okay.
And this is like the armpit area, but this is actually really important because one of the first places that breast cancer could spread to is to the lymph nodes in the armpit, and these are lymph nodes here. These are normal shaped ones, but that's something you look for.
Right, because if they reach the lymph nodes, that becomes a problem, doesn't it?
That's right.
That's when metastasis.
That's a form of metastasis.
Yes.
Exactly.
Okay.
You're on your way to go to medical school. Okay.
Yep. All right. Let's see. This is.
So this is a different way of looking at masses. This is an ultrasound image. And ultrasound uses sound waves to look at things. So the other one used the first set of pictures use X-rays. This uses sound waves, and sound waves here are showing a irregular mass. This is what this dark thing is.
Okay.
And then this is a measurement someone took, and this is something that when we see something like this, we'll oftentimes, and this is another role I have, is we do biopsies of things. So we'll bring the patient back in, we'll give them some local anesthesia to numb them up, and we'll use the ultrasound machine to guide a needle into this area, take samples, and then look under a microscope to see what's going on.
I guess, in other words, the best way to know what you're dealing with is to literally take what you're dealing with and look at it under a microscope.
That's actually very true. Very true. A lot of our ways of doing things, whether it's CT, ultrasound, or MRI, or mammograms, whatever you're dealing with, they give you a sense of what something is, and you could be fairly confident most of the time what it is in certain situations, but taking a piece of it and looking at it in a microscope is knowing what it is.
Yeah. All right. This one here, it's a bit thinner.
This is actually a picture of a little bit different, but this is a picture of a mammogram in a male patient. And so,
a male.
Yeah. Women get breast cancer. About 1 out of 8 women will get breast cancer in their lifetime, but it's not 0 for men. It's about 1 out of 800. So just threw that in there. Actually.
Yeah. So this seismic-wise, that is bigger than the first image that we were looking at.
Yeah.
Way bigger.
And the bigger things are, the more concerning they are typically.
Yeah.
Just because it means it's gone bigger and potentially it could have gone to other places too.
This is lungs.
This is a chest X-ray. I thought it'd be a good idea to look at one of these. So I'm just going to show some of the normal anatomy. So this is the heart right here.
I see. Yeah, I see it. Okay.
This is your trachea, your windpipe. You could feel that. It's going down and it's supplying your lungs. That's what the dark areas are, is your lungs. And you see these little white lines.
Yeah, that's the rib cage?
That's the rib cage, exactly. And this little pocket of air that's under your left diaphragm is usually your stomach bubble. So that's the gas in your stomach.
Oh, wow, okay.
Yeah. You could see each one of the vertebral bodies, which is the bones in your back, going through here. And there's something that shouldn't be here. And
Can I spot the difference?
Yeah. It's kind of hard, but I'll tell you that this outline is the normal heart.
Okay.
But there's something
that is the breast cancer?
That's actually a different kind of cancer. Now, you'll see on the next picture. So this is a CT scan.
A CT scan.
CT scans show cross sections of people. This is a cross section of someone's chest through here, through probably this level.
So it's as if you're looking down on.
Yeah.
Okay.
So now these are the ribs going around. This is the heart.
That's the heart.
This is the biggest artery in your body called the aorta. And then over here, this darker thing is...
That's lung cancer?
That's a lung cancer.
That's lung cancer, okay.
Exactly.
This is why you don't vape.
Nah.
This is why you don't vape.
Certainly not. Certainly not. I just threw this in here too. I mean, radiologists look at all sorts of things. We look at like everything from head to toe. We do interventions on things, and one of the things we get to do that I think is pretty special is we get to look at babies when they're inside their mothers. And this is a 3D ultrasound image of a baby.
Wow.
And typically the pictures are not this good. This is like this is kind of a lucky shot, but this is an ultrasound.
And the color is is afterwards?
Yes, I think
So unfortunately, we cannot ultrasound in color yet.
No.
No, can't ultrasound in
Well,
color yet.
actually, that's not true. You can get color information, but it will not give you this kind of color. Yeah. The color information will tell you about the flow of blood vessels and stuff like that.
Now I think that's kind of that's the end of the images. I guess I would like to ask, how do you think imaging studies are going to change over time? Like, what do you think is going to be the next future imaging technique?
Well, imaging is, changed a lot in the last 100 years or 150 years ago. Yeah, it was a big gap between just X-rays and ultrasound.
Almost 100 years, I think.
That's about right. And then the gap between ultrasound and CT and MRI was a smaller gap. But now we're, I think, approaching a different type of thing, which is we're using our computer technology to help us out with imaging. And this is where AI is coming in, artificial intelligence. So I suspect that in the next 10 to 30 years, there's going to be a lot of changes because of artificial intelligence. It's helping physicians find these kinds of things.
So the artificial intelligence would, I guess, be able to compound a whole bunch of data, I believe, of previous studies and results and data, and be able to just figure out through, not trial and error, but
machine learning.
Machine learning.
So yeah, there's a lot of active studies going on right now about using machine learning to train computers to go through raw data sets, which is just like pictures basically, and have them labeled by people, and then they'll use that information to be able to detect cancers, for example.
Wow.
And this is where healthcare is going. It's going to be us hand in hand with machines.
So that means that if someone now wants to go into the medical field, they should actually invest some time learning about computers?
Well, I don't know. See, the thing is I don't know, for example, if radiology, my field, will be around the same way if someone like you is interested in it. It'll be different. I suspect it'll be more, like we have a subspecialty of radiology called interventional radiology. Maybe that'll be taking the role more. The way that we interact with our machines to find out a diagnosis, it might be different. It's all up in the air.
What is this interventional radiology you spoke of?
Interventional radiology. So there are many fields of radiology. Interventional radiology is where most of radiology is where you're just using pictures to say, okay, this is a baby, but like for example, in this
you can go back.
This lung cancer. So we don't want a surgeon to have to open up the chest to be able to find out what this is. We can do something simpler. We could use a CT scan to guide a needle into this, take a sample, find out what it is.
You mean do a CT scan live while somebody is like on the table, put under,
That's
and
right.
the surgeon...
Well, the radiologist.
Oh, sorry, radiologist.
The radiologist goes in and does that, yeah.
Wow. I actually didn't know that CT scans are that live on demand.
Well, they could take a picture, and then you advance the needle a little bit, and then taking a picture.
So you're just taking pictures multiple times.
Yeah, they actually have live CT images too, but yeah, it's called CT fluoro, I believe. Yeah.
Is there a way to know when specifically you should use MRI versus ultrasound versus CT versus X-ray?
Yeah, there's different things. Different ones of those are better at different things.
Yeah.
If you're worried about where you broke your hand, an X-ray is what everybody gets to begin with.
Yeah.
If you're worried about your brain, an X-ray of your head is not going to do that much. It's just going to show your skull. You probably need a CT or MRI.
Yeah, that's right.
If you're worried about your gallbladder, oftentimes you get like an ultrasound. Just different things.
And of course, they have different risk factors. I mean, the risk factors are tiny, but yes, CT scans and X-rays are radiation. Ultrasound is not.
That's right, correct. It doesn't have any radiation. MRI also does not have any radiation.
That's right, yeah, magnetism.
Yeah.
Oh, yeah, speaking of magnetism, if someone were to have an implant, that would be problematic.
Certain implants can be, but certain ones are not. There's a whole list of devices that people place into your body that are not safe, but some of them are.
Is it true that an MRI machine can literally rip that kind of stuff out of your body? Like, is it that strong?
It can dislodge it, definitely. It can be dangerous. Yeah.
So
like
I guess don't lie.
Like, for example, you don't want to get an MRI of your brain if you had an aneurysm and that was clipped with the surgically clipped, and that clip, if it's magnetic, it'll just rip off and then it'll cause bleeding.
Oh no.
Yep.
So I guess that's when having a detailed medical history is very important.
Exactly. Yes, exactly.
So I guess to wrap things up here, is there anything else that any future radiologist should know before they start getting into the field of radiology?
Well, I mean, I feel like I'll just broaden it to medicine. You know, like
Okay.
I mean, I talked about where I think radiology is going, but I think if you're interested in medicine and you want to go to medical school, I would say the biggest things is, number one, find a mentor, find someone that you trust, and find out, you know, as much as you can from what they go through. Shadow them, follow them around. You know, I mean, we have kids that are your age that come to our hospital and they just want to know what is it going to be like if they're going to invest their whole life into this. And then I'd say study hard, work hard, try to do a lot of fun things, and also don't think of getting to medical school as a goal. Try to think of the whole thing as a process that you should enjoy.
Important, because you don't want to become a medical student and then realize you hate blood.
Yeah.
You don't like interacting with people, that sort of thing.
Yeah.
Well, thank you very much for joining us today on My World Science. As with all medical shows, please discuss any questions or concerns directly with your personal physician. Don't forget to follow us on Instagram and Twitter at MyWorldScience, or email us at MyWorldSciencetv@gmail.com. Until we meet again, please remember, think inquisitively. Thank you. Thank you, Dr. Azizollahi.
Thanks for having me.
Yeah. Thank you.